Hi, y'all. So, this is going to be a little bit of a get to know me / IVF chit chat. I'm going to talk about why my husband and I needed IVF and kind of our story of how we got there. So, I met my husband when I was 24 years old, and it was pretty much, I knew within 6 months that he was definitely the guy that I wanted to be with. So, fast forward 2.5 years later, we got married. And everything was wonderful. And about 6 months went by and we decided that we wanted to have a baby. And we figured we're both young. I was 28 at the time. And he was 2 years older than me. He was 30. We both weren't smokers. We didn't do drugs. My husband socially drinks here and there, but nothing major health-wise was of concern. So I talked to my doctor and they said to get off of birth control, give yourself a couple of cycles to regulate, and then I could start trying. So we did that. We started in September. I got off of birth control, and by December I still wasn't pregnant. So I am impatient. I always have been. It is my worst quality by far. So I went to the doctors, and of course I'm like, hey, something's got to be wrong. You got to look. And the doctor said, not a problem. We'll go ahead and we'll do an ultrasound to see what's going on there. He goes, I can only see what's there. I can't test function. And I said, okay, no problem. So he looks and he tells me, you are borderline PCOS, which made sense. I've struggled with my weight my entire life. I had recently lost about 130 pounds. Before I got married, so weight at that time was not an issue for me, but in the past it has been. I also did have irregular periods, but they put me on birth control and regulated it. So the doctor put me on something called metformin. Metformin is a drug that helps with insulin resistance, and it's very common for PCOS patients to take that. So I went on metformin, tried that for about a month, and he told me that if my cycles weren't regular, if things weren't working the way they need to be working, that we could also try Clomid, kind of up my chances. But he said to give myself at least 3 to 6 months on metformin. Little did I know, the next month we would get pregnant, which was amazing and wonderful. And we were actually in Disney, and it was February 28th that, unfortunately, that pregnancy did not end well. So we got back from Disney. I called, this is about mid-January when I found out. I called my doctor's office. They had me come in. They did a urine test. They confirmed, yes, you were pregnant. And the night before my 8-week ultrasound, which would have been the first heartbeat detection, I went to go to the bathroom. It was about 11 o'clock at night. Get up, I had to pee, and I doubled over in pain, severe pain. I don't know where, just happened. I thought that something was wrong with the baby. That was my first inclination. There was no bleeding, there was no cramping, there was nothing prior to. I literally was like this, bent over at my waist. I could not bring myself upright. I started hysterically screaming for my husband. He went and he got me and he carried me to the car, and we got to the ER. Thankfully, we live about maybe 5 minutes away from our local hospital. We got in there, and then the pain kind of stopped. I would say within 20 minutes. There was no pain medication given. I told them I was pregnant, that I was 8 weeks, and my ultrasound was tomorrow. So they brought a bedside ultrasound machine, because of course, pregnant woman complains of abdominal pain. The first question is something wrong with the baby? They come in, they can't see the baby in the ultrasound, but they said, well, maybe you're earlier than you think, or something's off. Don't worry about it. And I said, okay. So I'm waiting. They told me that they would monitor me for the night. They wanted to keep me just to make sure everything was okay. So they ran some blood work, and come to find out that a couple of my levels were a little out of whack. My HCG was in the thousands. It was in, I believe it was 13.5. So 13,500. And for those of you who don't know what HCG is, it's the hormone that's in a pregnant woman's urine or blood that lets them know how much of that hormone has been secreted. Usually anything over 1,000, you should be able to see something in an ultrasound. So the fact that mine was 13,000 and there was nothing there unfortunately meant that there was probably something wrong. So the doctor came in and she said that unfortunately she had a very good inclination that it was an ectopic pregnancy. For those of you who don't know what an ectopic pregnancy is, don't feel alarmed because neither did I. I had never heard that term before. I had obviously heard of a miscarriage before. I had heard of a stillbirth before, but I had never heard of an ectopic pregnancy. And essentially what an ectopic pregnancy is a pregnancy that has implanted outside of the uterus. So a woman's female organs are kind of shaped almost like a cow's head, like a steer with horns. So the uterus is here, and on top of it are these two tubes. And those two tubes go out and they kind of wrap around the ovaries, and they have little fingers. So what happens is the ovaries will release the egg and the little fingers grab it and bring it down those tubes into the uterus. Unfortunately, my egg only made it halfway through the tube. And actually, it was more than halfway. It was literally where the tube and the uterus connected. And I will insert a picture of the diagram that I'm discussing. So you'll see at the very end of the tube where it goes into the uterus, that's where my egg was. So my doctor lovingly drew it on my pictures. But what had happened was the embryo had implanted and it started growing and growing and growing and growing. And that pain that I felt was my fallopian tube rupturing. So essentially it split apart due to the pressure of the embryo growing, and I was internally bleeding. If that doctor had not done what she had done when she did it, I very well could have died. It is a very serious condition. And unfortunately, when women do get past a certain point in their pregnancy, 8-10 weeks, when this happens, it can result in death. And we were lucky enough that they were very understanding and that they found it right away. So they rushed me back into emergency surgery. They had to remove my entire fallopian tube. There was no saving it. Sometimes if they find the ectopic before it ruptures, they can save your fallopian tube, but unfortunately mine was shredded and I had about 2 full liters of blood in my abdomen. So I am going to show some pictures. They are the pictures that were taken during my surgery. If you do not want to look, that is totally fine. You can fast forward and I'll put a timestamp below of what the next time to jump forward is. The pictures are done showing. But if you're going through this, if you want to see what it looks like, if you want to compare it, please. I'm going to show you the first picture. So again, these were taken. So that first picture is all of the blood that was in my abdomen. And please focus. So you can see just kind of like that pool of blood. On the other side, you'll see in the picture that is circled right there, I'm sorry, I'm trying to get it to focus. That right there is the actual embryo that had implanted, and you can see where it's kind of clear. On the other side, you can see it again. And they unfortunately had to cut it out and remove it. So on that last picture, you can see the actual embryo inside of the sac that it had, ruptured, unfortunately. And if these are not clear, I'm going to go ahead and insert the pictures. After the surgery, that's where they connected it. And then the very bottom is what it looked like afterwards. So there's the uterus and there's the ovary. So again, that was what it looked like prior to. That's what it looked like in the tube. When they cut it out, the baby is right there when they reattached it and what it looked like at the end. So unfortunately, that pregnancy is not viable. When you have an ectopic pregnancy, there's no way to detach it and move it. So pretty much when that happens, the pregnancy is over. So we were assured by my doctor the other side looked fantastic, looked wonderful. They don't know why this happens. A lot of times it's due to scarring. My appendix did rupture when I was about 24 4. It was actually like 3 months after me and my husband started dating, my appendix ruptured and I was in the hospital for 10 days. So they said a lot of times women who have ruptures, women who have endometriosis, where the fluid will leak into their fallopian tubes, it can scar the little fingers, little phalanges that move the egg down. If they can't move it down, it stops and it implants where it's at. So a few days later, after I went home, unfortunately, in the recovery room, I'm going a little ahead of myself. In the recovery room, when I went to go get up to get ready to go home after they removed the baby, my stitches ripped open and they had to sew me back up. So when I got home, I became septic, which was not fun, and is, again, very life-threatening. So I went back into the hospital. I was there for about 4 days. They kept doing ultrasounds. They thought I had a little bit of internal bleeding. Come to find out, it was just an infection just from that happening. There was nothing I could really do about it. It just, unfortunately, was one of those things that happens. But they did find out that I needed to have my gallbladder out because my gallbladder was fully impacted with stones. Again, no pain, no issues, no problems. So this surgery was done on February 28th of 2019. I ended up having my gallbladder surgery in April and I got pregnant again. And when we found out that I was pregnant, we were so excited. We knew that my other side looked good. We were like, awesome, this is going to happen. This is it. We lost that one baby, which, going through what we went through, my husband not only possibly he did lose a child. Even though it was in those early stages, it's still a loss. It doesn't matter how far along you were. I could not imagine though being 6, 7, 8, 9 months pregnant and losing a child, but we still had dreams and hopes for this baby that was inside of me. But not only did he lose that, he also almost lost his wife. And for me, I wasn't thinking about myself. I was only thinking about that baby. And I was dealing with that. And we dealt with it in very different ways. My husband is very much a, pick yourself up by your bootstraps, dust it off, keep going. And I'm definitely an emotional, let me talk about it, I'm going to be upset for a while person. So we kind of had to grow together on that. So when we found out that we were pregnant again, it wasn't as happy as it was the first time because, our first thought was, could it happen again? And the doctor told us there was a very slim chance of that happening again. So I kind of just had a funny feeling. I went in for my ultrasound. They didn't see the baby. They took me early because I was now considered high risk, because once this happens once, they want to make sure it doesn't happen again. A lot of times that's usually more with women who have had their just the egg removed and not the actual I apologize, that not the actual fallopian tube. So a lot of times they get more concerned because if you've had the surgery and there could be possibly scarring, or it could get blocked again. So I went in there for my appointment. I would have been about 4.5 weeks, and they said that they didn't see anything, but my HCG levels were below 1,000, so that was okay. So they wanted to make sure that my HCG was doubling. So with a normal functioning pregnancy, your HCG should double it within 48 hours. They say it's a good rule of thumb, 60%. So not everyone doubles. So if let's say your HCG was at 50, some people might go to 100 and some people might only go to 75. 100 is better. Higher is always better. But if you were at your HCG at the next blood draw was only 75, it's still showing progress. It's when you start seeing numbers going from like 1,000 to only 1,200, or 1,200 to only 1,600. That's not doubling. That's not even at 60%. They want to see at least 60% or higher, and really they want to have a full double for it to be considered a healthy progressing pregnancy. Well, my HCG was doing that. Every 2 days, it was like a waiting game. They kept calling me. They're like, yep, your number went up. It went up. It went up. It's doing good. It's doing good. I think this is it. I think this is the time. So I went. It was a Sunday. It was actually the day before my 29th birthday. And I went and saw a movie with my dad. And I kind of left the movie and I just had like a weird feeling. Nothing really hurt, but it just didn't feel right. Something felt off. And I told my husband that something felt wrong. And again, this is literally, the funny thing is it ended up being it was the 28th of May. So it was 3 months to the day. And we went to the ER, and I told them that I was about 5.5 weeks, almost 6 weeks pregnant at that point. And I told them I had a history of ectopic pregnancies. I really wanted them to check for me. Again, with ectopic pregnancies, usually you have cramping, usually you have spotting or bleeding. I had none of those things. I had an appropriately rising HCG level. I even had morning sickness. Everything was progressing the way it should have been. But again, the doctors kept me in observation overnight, and they said they wanted to go in and do some exploratory surgery because of the fact of my history, and that my HCG was over 1,000 at that point, but there was still nothing on the screen. So, my husband went home. He had been with me all night, and the doctor hadn't told me this yet. So they said they wanted to keep me for observation. And so he went home, and I was in my room, and the doctor came in, and she told me that. And she said, I think there's a really big chance it's an ectopic. And that was really hard to hear, because depending on where that baby is, meant I was losing my other fallopian tube. And as they were wheeling me back from my exploratory surgery, my fallopian tube ruptured. I knew what it felt like because it had happened the time before, and I just started crying. I was crying because I was in pain, obviously, but it was more about the fact that my fertility, the one thing that I wanted more than anything was to be a mom, to have a baby. And now my choice, my decision, my life is impacted because I don't have that choice anymore. They're gone. My choice is gone. So they went in, and as you can see, this is the second one. And you can see the little baby there. And then they reattached it. So unfortunately, there was no saving. There was nothing that they could do. And I had to leave that hospital, and that was May 28th. So it's literally, my procedure dates are 3 months apart, exactly. And I left there having had 3 surgeries in 3 months. And I had to walk out knowing that I was never going to be a mom. Or at least I thought I was never going to be a mom. And I struggled with that a lot. It's not something that's easy. Ectopic pregnancies never are. Any type of time that you lose a pregnancy, I've learned so much. There are molar pregnancies. I mean, there are so many things that you find out when you enter into this world of infertility. So the main reason I want to share this is, if you're going through an ectopic pregnancy, if you've gone through it, if you unfortunately have had more than one, which I found out through Facebook, through support groups, through finding, sorry, I'm watching my son on the monitor, finding women who have had this, talking to them. 9 times out of 10, if you've had one, there's a good chance it can happen again. So I don't know where these doctors are getting these statistics, but a lot of times, unfortunately, it can happen. Not all the time, but you have to be hypervigilant. So signs of an ectopic pregnancy typically are bleeding, cramping, abdominal pain, your HCG not rising appropriately. Those are all things that are normal with ectopic pregnancies. I had none of those things. So you need to trust your gut instinct, because again, this is something that could seriously hurt you. And it can do some real damage and could really, unfortunately, cause some major issues. And it's not something to play around with. It really isn't. And honestly, it sucks having medical bills. I don't want to even think about what we paid out that first year. I think even with insurance, it was like almost $6,000. But your life is worth way more than that. And I'm here to tell you that if you just went through one, or if you're going through a second one, or your fifth one, or whatever it may be, maybe you've had a miscarriage, that doesn't necessarily mean it's the end of the road for you. And I say that because this little amazing person is literally sleeping. I don't know if you can see it, probably not. Is literally sleeping in the room next door. And we never would have thought that he would be here. Ever. And I'm a mom. It happened. It happened for me, and it can happen for you. And I just want you to know that there are people out here for you. And there is support, and there is help, and you mourn that loss. Don't let anyone tell you that you need to get over it, or you need to feel better, or you need to, it wasn't even a baby. It was a baby. It was a baby to you. It was a real life baby. That's how all babies start off. And the minute that you find out that you're pregnant, that's all you think about. You have to change your whole life. There's no drinking, there's no smoking, there's no eating this, there's no doing that. You can't lay on your tummy. You can't use certain hair products. You can't use certain makeup products. You can't use certain... Your entire life changed the minute that you saw that that pregnancy sign was positive on that test. So however long you were pregnant, 3 weeks, 4 weeks, 5 months, 12 weeks, it doesn't matter. You were a mom to that baby. My son is the only living child I've had, and I've been pregnant 4 times. The first one was a long time ago, and it was a very early chemical pregnancy, and it was something that I think if I had had that pregnancy with that baby would have made my life very different. I don't know if I would have met my husband, and so I do think all things happen for a reason. I think that the reason that I went through this, as much as it sucks and as much as it seems unfair, is because I am here to tell people about what I went through and to be a voice for someone else. And also to talk about how I was able to pay for IVF. If you have watched any of my other videos, you know that I'm a preschool teacher. I teach preschool. I love it. I love what I do. I've been doing it for 10 years, and I work at a private Christian preschool. It's fantastic. It's wonderful. I love what I do. But it does not pay the bills, to be completely honest. It is something that I do because I love it. It is not something I do for the money. And my husband is in law enforcement, so he has to work his tail off to pay our bills. He works 12-hour shifts, he works overtime, and paying $30,000 for IVF, because I live in Florida and insurance does not cover IVF in Florida. It's not mandated, was not in the cards. So I'm going to make a second video, and that's going to tell you all about how I was able to pay for my IVF. I got an entire cycle paid for, medication, also my embryo transfer, everything. And I'll break down how I did it and the cost and my results. I'm going to share my protocol. I'm going to talk about what I did prior to have fertility prep, because my problem was not getting pregnant, and I did not have that issue, but I do feel like what I did prior to gave me better results with IVF. And I think that it would work with someone who maybe did have some difficulty getting pregnant, or maybe not. Every person is different, but I felt like it made a big difference and change for me. So I hope you enjoyed listening. I know this video was kind of long, but like I said before, if you're going through this, if you've gone through a miscarriage, if you just need someone to talk to, and sometimes our spouses are not always the most, like I said, me and my husband had a hard time with this. We dealt with it 2 very different ways. My husband told me, I married you, and you are enough for me, which kudos to him, because I don't know if I could have said the same. I knew my want to be a mom was really, 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 really strong. And I love my husband, I do. But I don't know if I could have let that dream go. And the fact that he has no problem. He can obviously get me pregnant. That was not the issue. It's me. I'm the one that I can't do it because of what happened. It's not my fault. It's just, that's unfortunate. That's just the reality. And I have seen infertility tear people apart. I have seen infertility break down marriages. I have seen infertility cause depression. I mean, I was depressed when they wheeled me back. I think I cried the most gut-wrenching cry I've ever done because I thought my dream of being a mom was gone. So don't let it stop you. Do not let it get you down. Take your time to mourn. Take your time to honor these babies that you had, or, you know, had those dreams of having. That's okay. Do that. And if you've never been pregnant, mourn the fact that you've gone through that you've gone through years of want. You know, that's okay to feel like that. But I'm going to tell you in my next video on ways that you might be able to get some help, and ways that you might be able to afford IVF. And that's the whole thing, is medically, IVF sucks. It's rough. But I would do it 1,000 times over for my son. But financially, I wasn't able to. So I'm going to share in my next video about how that happened. So I really hope you enjoyed it, and thank you so much for staying and watching, and please like and subscribe. I'm really trying to kind of use this for my postpartum anxiety and IVF and weight loss, and just kind of like all about being a mom and being me. And, you know, if that interests you, then awesome. I'd love for you to stay and to watch more and to kind of build a community, and write some stuff down below. Talk about what you've gone through. Talk about where your life is at. Talk about your struggles. You know, I mean, I would love to be able to support you and talk to you. If you have any questions, please inbox me. Let me know. I can try to answer them. I'm not a doctor. You know, this is not medical advice, but I can at least be here to help. So, thanks for watching. And that is actually the baby. So until then.